Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with bilateral, really blocked ears, and this is the patient's left ear. They felt this was the worst ear out of the two. In fact, they didn't feel that their right ear was blocked until I removed this blockage from their left ear. And indeed, the right ear, so the ear that they thought that was fine, ended up being a bit more complex and difficult to remove. And that's quite common practice, actually. Quite often patients come in and they only report symptoms in one ear. And once we've cleaned that ear, and they then can notice the difference with the opposite ear, what we call the contralateral ear, so the opposite ear to the ear that we're examining or treating. And quite often, for some unbeknown reason, that second ear, which we thought it's not going to be no problem, is quite often the more difficult one to remove. So with this ear, there's a combination of dead skin, dead keratin, and it's got really mushy, and also some earwax, and it's fully occluding. And because of the consistency, it's very difficult to suction. It's quite deep, so it's a bit more complex to use hooks and scoots because you might make contact with the bony part of the ear canal, which is sensitive. Therefore, I've just installed some olive oil drops. What that's done, it's kind of binded this dead skin and wax together in almost in the same way an egg would in a potato cake or fish cake recipe. I've used that analogy a few times. Quite often I do actually use food analogies when explaining earwax because the consistency is very similar to certain foods. And for example, earlier I mentioned mashed potato. So dead skin can have that consistency. The olive oil also helps to lubricate the ear canal wall. Therefore, if you've got, for example, a ring stuck on your finger and you use a bit of soap because it's stuck, that soap helps to lubricate the inside of the ring and also your finger to facilitate the removal of the ring in the same way that oil lubricates not only the ear canal, but also the inside part of the suction tube. So if a bit of mushy wax or keratin does get stuck in there, the oil will just help move it along. It'll be less resistance. So what we're doing now, I'm just mopping up some of this dead keratin. This is at the entrance of the ear, and you can see the patient's got quite a pronounced valley here. The ear canal really goes downwards into a trench, and it comes back up. And there's a bit of dead skin here. This is possibly one of the reasons why a patient is experiencing a chronic problem. They have to attend every 4 to 5 months, believe it or not, and it's plausible that the skin that lines the ear canal, as that dies and sheds, it moves sideways out of the ear in a conveyor belt motion, and any wax sitting on the surface of that skin is naturally transported out of the ear. So the ear is self-cleansing, so as the skin dies, sheds, moves sideways laterally out of the ear, anything sitting on the surface of the skin is also transported out of the ear. But when you've got a cave like this, skin sometimes gets trapped. It can no longer migrate. Therefore, you then sequentially and as a result also get a blockage of earwax there. So eardrum's intact. It looks slightly retracted, buccal inwards, but pressure testing, tympanometry, we call that, came back fine. And this is the patient's right ear, so this is the one that they felt they don't have a problem. But as soon as I cleared the left ear, they then realised the right one was also blocked. So, of course, the left one was causing more of an impaction. There's a bit of a gap at the top here, at the roof of the ear canal, which was probably allowing a bit of natural air and sound to enter. Immediately put some olive oil drops in. This is just a lot more mushy. It's a lot more difficult to suction. And I am just trying to loosen some of this dead skin from the back part of the ear canal wall here. I think I'm going to have to put some more drops in a moment. When I first started putting drops during the procedure, I used to allow the drops to soak for a few minutes. And I still do that, of course, but before re-entering the ear, I used to then ask the patient to tilt the head in the opposite direction. So this being the right ear, I'll ask them to tilt their head so they're right. The head's tilting over to the right shoulder, so the ear's facing the ground, which then allows the drops to drain. But the more and more I've been now using drops in the procedure, I'm actually performing the procedure whilst the drops is still in the ear. So in this case, the patient's head is still tilted over towards their left shoulder, this being the right ear, so the drops can penetrate. And I'm actually stood up a bit off my stool, and I'm actually suctioning whilst the oil's in. Sometimes it can be a bit tricky because the oil's still in the ear, you get a bit of blurriness as the sucker is suctioning the wax and dead skin. It's also suctioning some of the oil, which causes a bit of a glare. But once you've done it a fair few number of times, you gain a lot of confidence. And I just think that technique's a bit better. So you can see this actually is coming off the canal wall now. And in a minute, it's going to come out in a big plug, one singular piece. So I've just got the suction probe a bit deeper in the ear, and I'm trying to get contact with the more medial wax and dead skin. You can see I'm hovering this forwards, and it is actually I'm trying to glide this out in other words, and that's the technique I'm using. I'm using the sucker to get a suction grip and hovering over it, and then coming back out, and it is slowly bringing it towards the entrance now. And I'm just lifting this off the bottom of the ear canal and off the anterior canal wall. So the anterior canal wall is the front part of the ear canal. So in the case of the right ear, it's the right-hand side. If it's the left ear, the anterior canal wall is the left side. And now I'm just teasing this through the ear canal entrance. And you can see we managed to extract this in one huge plug. And if we re-enter, just mopping up near the entrance, there's a bit of debris just in the cartilaginous portion. So again, there's a bit of valley here. There's a bit of a dip in the ear canal. And given it's in both sides, it's just an anatomical, I wouldn't say abnormality, but it's something that the patient's just been born with, and over the years it's become more problematic. So they're the two plugs. The plug bottom left is the left ear, top right is the one we just removed from the right ear. And you can see that on both plugs, the tip, that's where you've got the dead skin. It's a bit lighter in shade, and that's a bit more mushy in consistency. And then beyond that, you've got the wax. It's in a big plug. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak to you soon. Bye.